Good afternoon. Thank you for joining us for the June Provider Workshop featuring Fremont Therapy Group's Katie Adams and Morgan Espino. Fremont Therapy Group has been taking care of physical therapy needs of Carbon County residents for years and has recently partnered with Memorial Hospital of Carbon County. Thank you, Katie and Morgan.
Okay, awesome. Well, thank you for having us. Today we're going to talk a little bit about what physical therapy is, some of our different roles in the outpatient clinic, some of my specialties, some of Morgan's specialties, other services that we offer at our clinic, and some of the benefits of physical therapy. Fremont Therapy Group has a few locations. Of course, we're here in Rollins. We also have clinics in Lander, Riverton, Green River, and Rock Springs. And in a partnership with the Memorial Hospital of Carbon County, we're also starting up a new clinic in Saratoga soon. With that partnership, we also provide inpatient care for our patients who are admitted to the hospital. We also partner with some home health agencies and provide physical therapy services for patients who are stuck in their homes and have a hard time getting out. We also are partnered with the Carbon County School District number 1 to provide physical therapy services for children who have IEPs. And with our athletic trainer, Adam McFarland, we provide athletic training services at the school as well. The vision statement of our profession is transforming society by optimizing movement to improve the human experience. Basically, physical therapists and physical therapist assistants work on identifying movement dysfunctions and working to improve those. So movement dysfunction could be if you're having pain with movement or with staying in a certain position, anything like that, and it can be caused by an injury, disabilities, or other health conditions that can affect your movement. We work to identify the cause, and then we use exercise and other treatment techniques that we've been trained in to improve your movement and your quality of life. We also work on injury prevention as well. The first person you're going to see in outpatient physical therapy is your physical therapist, of course. At this time, physical therapy at entry level is considered a doctorate level profession. We also have direct access in the state of Wyoming, which means that you are able to come see us without the need of a doctor referral at the beginning, just to see us. We work to identify the cause of your problem or your pain, and then we're going to create a plan of care to try to address it and fix it. We work closely with your doctors and communicate with them about your progress so that they know how you're doing as well. We also work with physical therapist assistants, and they are trained in a lot of treatment techniques and lots of exercise, and they work under the physical therapist's plan of care and supervision to help you feel better. We have physical therapy technicians also. The first and second pictures here are Courtney and Perry. They're our techs, and they are all over our clinic helping with getting you hot packs or cold packs, e-stim. Sometimes they help us out with getting you started on exercises, and basically they just make our clinic function and run smoothly. We also have our patient care coordinator. In our case here in Rollins, it's Randy Tanner. And she's the gal that you're gonna see at the front desk when you first walk in. My specific specialties and areas of interest include neurologic rehabilitation. So when I'm in outpatient, I'm primarily seeing patients who have neurologic conditions such as strokes, brain injuries, Parkinson's disease, multiple sclerosis, or peripheral neuropathy. There are a lot of different kinds of neurologic conditions, but these are some of the ones that I see the most here in Rollins. A lot of these folks need help with gait training, which just means if you're having a hard time walking, I can help you get better at that and more confident so that you can access your home and community more safely and independently. I also have a major interest in vestibular rehabilitation, which is a really fancy way of saying that if you're dizzy, I can help you with that. A lot of people say that they have vertigo or that they've dealt with vertigo for years, and I think most people don't realize that if you're dealing with dizziness, a lot of times we can fix it. So there's a lot of different causes of vertigo or dizziness, and I can help you to identify what's causing it and then create a plan of care to try to fix it. Of course, all of these incorporate balance, and you don't have to have a neurologic condition or a vestibular condition to have poor balance. Sometimes as we get older, we just don't have as good of balance. And people a lot of times tell me that they're not feeling as safe getting around their home and they're afraid of falling or fracturing their hip or something like that. If you come into physical therapy, we can get training you for improved balance so that you feel more safe and independent again. I'm also trained in dry needling, and that's used for muscle pain. I also use it sometimes in my patients who have neurologic conditions to manage tone. But primarily it's used for muscle pain, and it's very similar to an acupuncture needle, and we use it in a different technique than acupuncture. And instead of targeting meridians or something, we're targeting specific trigger points in the muscle to try to get it to relax more so that you have less pain. I also work at the hospital. I'm the lead physical therapist for our inpatient care, and I'm seeing all of our folks up there who need to be able to get home safely. And by working with me, these patients get to work on their safety and balance with walking and stairs and anything they need to do to be able to get home safely and live independently again. And now I'll hand it over to Morgan.
Hi, like Katie said, my name is Morgan Espino. I'm a physical therapist assistant. So like she said, after the plan of care is set up, a physical therapist assistant can kind of take over. We can talk about the goals that have been set up, and then we can figure out, I kind of say that I get a point A and B, and then I get you there. So I'm really detail oriented, and I like to figure out, exactly what the specifics are to get you to those goals. So some of my specialties and areas of interest, I do a lot of the work with Carbon County District 1, and that includes bags. So any kids, as Katie said, that have an IEP, which is an individualized education program, that can mean that they have special needs or any type of like motor dysfunctions or things like that that don't allow them to participate in PE or have difficulty in the classroom. I help them along with Nate Tanner, and he sets up the plan of care for them, and I help them reach their goals. I also do a lot of the pediatrics in the outpatient clinic that we have. So some interests that I have is women's health. I really think it's super important. There's a lot of applications to it. It's a really broad term, but basically what it means is strengthening your pelvic floor. Now this can be before or after pregnancy. It can be due to pelvic trauma. There's a lot of things that you can do. Now again, because I'm a physical therapist assistant, you would have to get it set up with a provider. We have one in Rock Springs and one in Lander that will set up your initial plan of care. And then if you don't want to travel there every treatment, you can come to me for the treatments, and I can communicate with the physical therapist there. And I just think that there's a lot of applications for women's health, especially in this area with the new OBGYNs that we have. I also work in the hospital with Katie, so I usually show up in the afternoons for our patients that get 2 treatments a day. I was also a rehab tech in a hospital in Texas for 3 years, and that's really where I got my foundation for a lot of the things that I do in the hospital. A lot of the equipment and stuff Katie and I collaborate on, I know from my background there. I also do quite a bit of the home health and just geriatrics in general too. Working with elderly people. I have worked in the nursing home before, so there's a lot of people that need help in Rollins, and I love helping them. So some other services that we offer at our clinic, we have an aquatic therapy pool. It's super awesome. It's like 98 degrees in there. And a fun fact about aquatic therapy is actually if you go all the way up to your neck, you're only weight bearing 10% of your own body weight. So this is a great way to get people moving that have issues with standing and fully weight bearing. So after surgery, if you have weight bearing precautions and your incisions are all healed, you can absolutely do aquatic therapy. There's so many other applications for it, but those are just a few. And it's also something that you can do as part of an independent program. We do offer that at our clinic. and you just pay a fee every month, and you can come and use it, you know, whenever you wanted. So we do some sports rehab. Adam, as you see in the picture, is our athletic trainer. He's the one on the left there in the red shirt. He works with Carbon County 1. He does sports metrics training, so that's for athletes during when they're not in sports, and then he also has a concussion management protocol that he uses when he's on the field. And then Elisa McSpadden, she is certified in kinesiotaping. That's something that you'll see a lot of athletes wear, and there's a million different applications for that. That's something she does. And then functional movement assessments and fit for duties. There is a work comp test called an FCE, a functional capacity evaluation, and Nate and Elisa, Nate is our clinic director, they both do those. And then women's health, like I said, there is a clinic in Lander and Rock Springs. Skylar is another one of our physical therapists. Him and Nate are going to be in the Saratoga clinic a lot, so you'll see them. And then Wojtek has been around for a very long time. We love him very much. He was the lead therapist for a very long time in the inpatient center, and now he works with us in outpatient a lot, and we love him. So, according to the American Physical Therapy Association, there's a lot of benefits and results that you can get from physical therapy. So obviously we're gonna restore your movement and function, we're gonna help you manage your pain, we're gonna reduce the symptoms of sometimes some long-term conditions. Katie has, I'm just gonna brag on her a little bit, but she has seen some results with some people that are doing things that they never thought that they could do before. So don't think that because you've had something for years and years, there's nothing that we can do about it, because that's just not true. And then obviously recovering from or prevent an injury. So that includes a surgery, things like that. So your results, we're gonna maximize your movement. We're gonna help you do what you wanna do the best way you possibly can and the safest way you can. And you can get your recommended amount of physical activity in a day, which the Mayo Clinic says is at least 30 minutes of moderate physical activity. Now, I don't know about you, when I'm by myself, moderate probably doesn't happen. I usually need help with that, and so that's something that as you work with physical therapy and you have a condition that gets set up in your plan of care, we can help you make those goals to get your amount of physical activity a day. Reduce opioid use is a huge result of physical therapy. That's something that's a huge epidemic I think in our country, and helping you with pain management strategies is a way to reduce your amount of those. And also you can avoid surgery. There's a lot of people that have come to us that need some strengthening and some conditioning, and they can either prolong or avoid surgery. And the last thing I want to do is show you a testimonial video of one of our best and brightest patients. The pandemic, I think, has all hit us hard a lot, and some people got really hit hard with COVID, and he came to us, and I'll just let him tell you his story.
I'm Steve Kelly in Rawlins, Wyoming, Fremont Therapy. I started my therapy here 1st of February and finished the 1st of May. I came in here for COVID recovery and completely turned my life upside down. I went in there breathing fine, walking 32 miles a week at my house and outside, and when I came out of the hospital, my goal the first week out of the hospital was to walk 1,000 steps. And now I'm back up to walking about 21 miles a week. I had my shoulder surgery done a few years ago, and I learned from that if you want to get better, you have to put the work in. And the people here did a wonderful job with me, but I also had to do that work at home. I had spent virtually 5 weeks in the hospital, so my muscles atrophied. And when I came in, I had virtually almost no muscle that I had before. And in the 3-month period, I was able to get probably 80% of that back. And the therapists would help me with that, but also with my breathing. Because you have to breathe to be able to do the exercise. And I started with 5 liters of oxygen, and I ended up, my last day here, I didn't use oxygen except for the little machine over here that I get on. The best way to start for recovery from COVID is make sure you keep your oxygen up and start walking. Like I said, 1,000 steps a week, and now I'm doing 50 to 55,000 steps a week. But I started with 1,000 steps. So just start walking. If you're at home and not coming to therapy yet, do as much walking as you can while maintaining your oxygen.
So Steve is just a great guy, and what he failed to mention is that he put in a lot of hard work, and that's kind of what...
Oh my goodness! Look at you!
That's kind of what I like to tell patients is that, you know, we're a team, we do it together, and I think that's just something super important if you're going to come to us, that you know that you're not going to be in it alone. And then that's our physical location. We're at 1102 West Spruce Street here in Rollins. That's our number, and then at FremontTherapyGroup.com you can hit locations, and then you can find the Rollins Clinic and also look at all of our other clinics. So now we're ready for any questions.
All right, so we have a few questions here for you. The first one is, what services do you provide here in Carbon County that many would believe that they need to travel outside of Carbon County to get done?
Personally, I do a lot of neurologic rehab, like I talked about before. There aren't a whole lot of neurotherapists in the state. And I definitely have met a lot of people in town, not even just through physical therapy, but just through living here, that have had something like a stroke and never sought treatment for it because they didn't think that there was someone who could help them improve their function again. Just being a rural place, I don't think people realize that we can provide those services here. We're also planning to be getting a solo step, which is an overhead track system with a harness right now. So for people who are really nervous about their balance and afraid of falling and maybe think that they can't walk without falling, or for people who really can't walk without falling and maybe haven't walked in years, this harness will help to provide a little bit of support, prevent you from falling and getting injured, and we can train you to walk using that. And as far as I'm aware, there is no clinic in Wyoming that has one so far.
Awesome. And then what kind of elderly-centric services does Fremont Therapy Group offer?
I think our home health is one of the biggest ones. People that can't physically leave their homes, that's always a really big concern, not just for the patient, but for their families and their caretakers. I know that's an area that definitely is in need here. And I mean, sometimes in the winter, people can't even leave their houses, and obviously if we can't get there, that's a problem. But just people that have trouble getting out of their homes, and then also inpatient, if you're going to be in the hospital, that's something that we can make sure that you get on a consistent basis, and make sure that you can get where you want to go, home or otherwise.
And we do a ton of balance training.
Yeah.
So then kind of attached to that, have you noticed any specific needs, specifically in this community, that stand out as a whole to you, that's specific to Carbon County?
I just think the idea that there's physical therapy here, what we do, I think that was the best thing about getting asked to do this, was just that, you know, there's not a whole lot of access here. So just knowing that you don't have to live with pain, you don't just have to suck it up. You know, everybody in Wyoming is very tough, and that's awesome, but just know that you don't have to live with pain. I just think that's the biggest thing.
And then looking at your website, there's a lot of mention of evidence-based care. Can you kind of go into that and kind of explain a little bit?
Evidence-based care means that we're focusing on what the research has shown us to be effective, and we use that as part of our guiding treatment. So we're going to take that in conjunction with your needs and your preferences and what you're hoping to get out of therapy, what your specific goals are, and then we combine those two things to create the best plan of care for you individually.
And I always try to explain that to patients when they come in too. You know, they'll think, oh, you know, why am I strengthening my core? I'm here for my back. But, you know, I explain research shows that when you have a strong core, it can help support your back. So that's the kind of ways that we use evidence-based and research in our practice.
Yeah, or you have knee pain and it's probably because you have hip weakness. So you know where you're feeling the pain, and that's important for us to know. But also we know from all the research that's out there that if we strengthen the hip, you're going to have better results. So we combine those two things, and that's what our treatment's based on.
And then the last one I have for the moment being is, what is the best way to reach you guys to schedule an appointment? And do I need a referral from my provider first?
Well, calling us at our office number is the best way, 307-370-9175. And as far as providers, like Katie said, we do have direct access in the state of Wyoming, so you don't need to have an MD's referral to see us. The caveat to that is that some insurance companies will require you to have a MD referral. So you need to get in contact with your insurance company and figure out those answers. If you do, obviously there's the family practice clinic, just your primary care provider can write you a referral for physical therapy, and we can start there.
And sometimes if you've seen your doctor recently enough, you could just give them a call and let them know that you were interested in getting physical therapy, and they might just write you a referral that way.
Another option too is we do free 15-minute consults. So if you want to call and schedule that with a therapist, physical therapist that has time, we can just they can look at you and kind of decide, is it worth it to go get an MD referral if your insurance requires that? Do you even need therapy? Things like that. That is something that we offer, and you can call our number anytime.
All right, and I don't see any more comments at the moment here, but just for those of you watching, if you do have any questions for Katie and Morgan, feel free to leave them in the comments, and we will do our best even after our live performance to kind of reach out and get your questions answered. But other than that, did you guys have anything you wanted to say in the last final?
I don't think so. It's been a pleasure to serve the people of Rollins, and stop by anytime and we'll help you.
All right.
Thanks for having us.
Well, thank you, Katie and Morgan.
Thanks.